Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. These are NCLEX practice questions. Without delay, let's get started.
Which of the following breathing rates should the nurse use when performing rescue breathing during cardiopulmonary resuscitation for a 5-year-old? 1. 10 breaths per minute. 2. 12 breaths per minute. 3. 15 breaths per minute. 4. 20 breaths per minute. The correct answer is 1. Rescue breaths should be delivered slowly at a volume that makes the chest rise and fall. For a 5-year-old child, the rate is 10 breaths per minute. If the nurse is also administering chest compressions, the rate is 2 breaths for every 15 compressions. An 11-year-old is admitted for treatment of an asthma attack. Which of the following indicates immediate intervention is needed? 1. Thin, copious mucus secretions. 2. Productive cough. 3. Intercostal retractions. 4. Respiratory rate of 20 breaths per minute. The correct answer is 3. Intercostal retractions indicate an increase in respiratory effort, which is a sign of respiratory distress. During an asthma attack, secretions are thick, the cough is tight, and respiration is difficult. If mucus secretions are copious but thin, the client can expectorate them, which indicates an improvement in the condition. If the cough is productive, it means the bronchospasms and the inflammation have been resolved to the extent that the mucus can be expectorated. A respiratory rate of 20 breaths per minute would be considered normal and no intervention would be needed. On finding a child who is not breathing, the nurse has someone activate the emergency medical system and then does which of the following first? 1. Clear the airway. 2. Begin mouth-to-mouth resuscitation. 3. Initiate oxygen therapy. 4. Start chest compressions. The correct answer is 4. When breathlessness is determined, the priority nursing action is checking a pulse and beginning compressions. After 30 compressions, the nurse opens the airway and gives 2 breaths. Oxygen therapy would not be initiated at this time because the child is not breathing. Also, administering oxygen therapy would interfere with providing mouth-to-mouth resuscitation. A 6-month-old on the pediatric floor has a respiratory rate of 68, mild intercostal retractions, and oxygen saturation of 89%. The infant has not been feeding well for the last 24 hours and is restless. Using the SBAR Situation Background Assessment Recommendation technique for communication, the nurse calls the primary health care provider with the recommendation for 1. Starting oxygen. 2. Providing sedation. 3. Transferring to PICU. 4. Prescribing a chest CT scan. The correct answer is 1. The infant is experiencing signs and symptoms of respiratory distress, indicating the need for oxygen therapy. Sedation will not improve the infant's respiratory distress and would likely cause further respiratory depression. If the infant's respiratory status continues to decline, she may need to be transferred to the PICU. Oxygen should be the priority as it may improve the infant's respiratory status. A chest CT is not indicated. However, a chest X-ray will be another appropriate recommendation for this infant. A 12-year-old with asthma wants to exercise. Which of the following activities should the nurse suggest to improve breathing? 1. Soccer. 2. Swimming. 3. Track. 4. Gymnastics. The correct answer is 2. Swimming is appropriate for this child because it requires controlled breathing, assists in maintaining cardiac health, enhances skeletal muscle strength, and promotes ventilation and perfusion. Stop and start activities, such as soccer, track, and gymnastics, commonly trigger symptoms in asthmatic clients. A child has just ingested about 10 adult-strength acetaminophen pills. The mother brings a child to the emergency department. What should the nurse do? Place the interventions in the order of priority from first to last. 1. Administer activated charcoal. 2. Assess the airway. 3. Reassure the mother. 4. Check serum acetaminophen levels. 5. Obtain a history of the incident. 6. Complete a physical examination. The correct order is 2, 1, 3, 6, 5, and 4. Immediate care of the child who has ingested acetaminophen is to ensure airway, breathing, and circulation. Next, the nurse should administer activated charcoal. Acetylcysteine mucimist may also be used as an antidote. When the child is stable, the nurse should reassure the mother. Next, the nurse should perform a physical exam to assess the child for other health problems, and then obtain further information about how the child obtained the aspirin. The serum acetaminophen level should be obtained 4 hours after ingestion. The triage nurse in the emergency room must prioritize the children waiting to be seen. Which of the following children is in the greatest need of emergency medical treatment? 1. A 6-year-old with fever of 104 degrees Fahrenheit, a muffled voice, no spontaneous cough, and drooling. 2. A 3-year-old with fever of 100 degrees Fahrenheit, a barky cough, and mild intercostal retractions. 3. A 4-year-old with fever of 101 degrees Fahrenheit, a hoarse cough, inspiratory stridor, and restlessness. 4. A 13-year-old with fever of 104 degrees Fahrenheit, chills, and a cough with thick yellow secretions. The correct answer is 1. This child is exhibiting signs and symptoms of epiglottitis, which is a medical emergency due to the risk of complete airway obstruction. The 3- and 4-year-olds are exhibiting signs and symptoms of croup. Symptoms often diminish after the child has been taken out in the cool night air. If symptoms do not improve, the child may need a single dose of dexamethasone. Fever should also be treated with antipyretics. The 13-year-old is exhibiting signs and symptoms of bronchitis. Treatment includes rest, antipyretics, and hydration. When preparing the teaching plan for the mother of a child with asthma, which of the following should the nurse include as signs to alert the mother that her child is having an asthma attack? 1. Secretion of thin, copious mucus. 2. Tight, productive cough. 3. Wheezing on expiration. 4. Temperature of 99.4 degrees Fahrenheit. The correct answer is 3. The child who is experiencing an asthma attack typically demonstrates wheezing on expiration initially. This results from air moving through narrowed airways secondary to bronchoconstriction. The child's expiratory phase is normally longer than the inspiratory phase. Expiration is passive as the diaphragm relaxes. During an asthma attack, secretions are thick and are not usually expelled until bronchioles are more relaxed. At the beginning of an asthma attack, the cough will be tight, but not productive. Fever is not always present unless there is an infection that may have triggered the attack. When developing the ongoing plan of care for the parents whose infant died of sudden infant death syndrome, the nurse should plan to accomplish which of the following on the second home visit? 1. Allow the parents to express their feelings. 2. Have the parents gain an understanding of the disease. 3. Assess the impact of the infant's death on their other children. 4. Deal with issues such as having other children. The correct answer is 1. The goal of the second home visit is to help the parents express their feelings more openly. Many parents are reluctant to express their grief and need help. The goal of the first visit is to help the parents understand the disease and what happened. The first visit also provides time to help the parents understand that they are not to blame. Although it is important to assess the impact of SIDS on siblings, this is not the primary goal for the second visit. However, the nurse must be flexible in case problems involving this area arise. Typically, parents are unable to deal with decisions, such as having other children during the second visit, because they are grieving for the child that they lost. This topic may be discussed later in the course of care. A 12-year-old with cystic fibrosis is being treated in the hospital for pneumonia. The primary care provider is calling in a telephone prescription for ampicillin. The nurse should do which of the following? Select all that apply. 1. Ask the unit clerk to listen on the speakerphone with the nurse and write down the prescription. 2. Ask the primary care provider to come to the hospital and write the prescription on the chart. 3. Repeat the prescription to the primary care provider. 4. Ask the primary care provider to confirm that the prescription is correct as understood by the nurse. 5. Ask the nursing supervisor to co-sign the telephone prescription as transcribed by the nurse. The correct answers are 3 and 4. To ensure client safety in obtaining telephone prescriptions, the prescription must be received by a licensed nurse. The nurse should write the prescription, read the prescription back to the primary care provider, and receive confirmation from the primary care provider that the prescription is correct. It is not necessary to ask the unit clerk to listen to prescription, to require the primary care provider to come to the hospital to write the prescription on the chart, or to have the nursing supervisor co-sign the telephone prescription.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.